Ignacio Wistuba, oncologist from the MD Anderson Center in Texas, United States. You've just been here at the Onkologisk Forum in Norway to talk about how pathology is evolving in cancer. Could you please give us a short summary of the most important topics from your presentation here today?
Sure, and thank you. I'm actually a pathologist and work in the translational research to identify biomarkers to actually how we can select patients for better treatments. And I work particularly in lung cancer research, and that has changed a lot over the last 20 years with molecular and now immunology analysis of the tumors from the patient to try to select the best treatment options. And one thing that we have learned is that actually pathology using computational tools can help. Can facilitate the work by first using those tools to investigate by the spatial composition of the immune response in tumor, and we are finding good answers that can explain why patients respond or not respond to treatment, and B, also we can use computational tools to help our work by assessing different changes in the tissue after treatment. This is computational tools that people actually refer sometimes as AI, artificial intelligence, is really changing the way that we do research, particularly in the setting of immunology, as explained, and also the way in the future to do our practice, not only by looking images and making diagnosis there, but also assessing biomarker or changes that the patient happen in the tumor after treatment.
How much will this impact the future of cancer treatment?
I think that's going to impact a lot because we are learning by different tools, and computational pathology of the tumor is one of them, but also we have a lot of artificial intelligence data from the imaging from the patient, from the CTs, from the other form of imaging. We have also learning to data science approaches, how to capture clinical information from the clinical chart, and all those are going to help us to model better how to treat patients. So in the future, what this concept of artificial intelligence, in my opinion, will be up to going to be available for doctors actually when they see patient, because they're going to do a multi-parametric analysis of the patient based on the clinical features, based on the imaging feature of the CTs and other images, and also from the characteristic of the tumor.
Just a short last question. You've talked here today to many of the greatest oncologists here in Norway. What is your best tips to get started doing this in their clinical everyday life?
Yeah. I'm going to focus on the pathology, which is my field of work. It's basically to pathology department to adapt digital pathology, which means scan all slide produced in the laboratories and store those images in a clever way that actually can be identified in the future, and then many actually clinical pathology, we may use those digital images to do daily activities like diagnosis. And actually during pandemic, many places actually enhance their digital pathology capabilities so people could work potentially from home, right, and make diagnosis. So that needs to happen throughout a pathology department throughout the world, and then all those images can be used in the future for this research. Yes, as I mentioned, using them also in the context of biomarker development or correlating with imaging like CTs or correlating with the clinical data, and build this multi-parametric or kind of algorithm to better face a patient for future treatment.